have enough sperm to do an IUI, or the patient has blocked tubes. Every other situation, there's options, right? They may not be good options, but there's options. And our job is to inform you of those options. If your doctor just says this is your only choice, go to another doctor. Okay, wow, I fell behind on that one, sorry. Is a trigger shot used with your endo FET protocol? No, we do not use a trigger shot, and here's my reason why. Trigger shots make you release an egg, which then creates its own progesterone from the corpus luteum. And then you have to play like adjustment game with your natural progesterone going up, the progesterone we're giving you, you have to taper down, and then your natural will taper down, and then you have to make it go back up. It's just chaos. So skip it, don't trigger, just start the progesterone. Then you don't need to worry. You're, iatrogenic, the progesterone we're giving you will probably prevent ovulation in time, and then you don't need to worry about your body's natural progesterone. You just have the one we're giving you, and we get that nice steady level so that everything works out well. I need some tea because I'm losing my voice. Can an ovulated egg still be collected in retrieval? OPU collected other, where would be OPU collected other follicles? Not sure I understand that question, but yes, if we go in occasionally and the follicle has just started to collapse, once in a while we'll get lucky and we'll get an egg out of there. Otherwise, no. But every once in a while we will get lucky and we'll be able to pull an egg out. I've done it a handful of times, and it's always worth trying, but it doesn't work very well, for sure. I mean, I wish the results were much better. Oh, that is good tea. What does it mean when Provera won't induce a bleed? That is a great question. You know what? I should make a video on this. There are only 3 reasons why you would not have a progesterone withdrawal bleed. This is an exam question for fertility specialists. So number 1, most common, you're pregnant. If you're pregnant, you're not going to have a withdrawal bleed most likely on Provera. Number 2, you don't have enough estrogen, and your estrogen is not synthesizing enough of a lining. So menopausal status could prevent it. Any kind of estrogen blockade could prevent it. Or the one very, very rare circumstance associated with that, your testosterone level is so high, it's overriding your ability for your body to respond to estrogen or progesterone, which is super rare. You basically have to be a woman on progesterone, on testosterone. Other examples of where your estrogen would be really low: eating disorder, extreme exercise like the Olympians, and so on. And then the last reason, you're blocked. So your cervix is stenotic, you have Asherman syndrome, something like that. So it's pregnancy, it's not enough estrogen or too much testosterone, or it's an obstruction, a blockage. That's a great question. Do you typically see high or low estrogen with endometriosis? You can see both. I mean, we have people with normal estrogen levels with endo, low estrogen levels with endo, high estrogen levels with endo. So you can have any kind of mix. It's frustrating not seeing the questions on the side panel. Thank you for typing them all out, Nat. What are the benefits of using birth control before FET? There are no benefits to using birth control before FET. It should not be used unless you have to. In fact, there are studies that suggest it increases miscarriage risk, so we don't do that. How long should it be taken? It shouldn't. Should endo patients take it? Definitely not. So we don't use birth control before FET ever. I would advise that that's probably pretty high risk. You think I'll start seeing questions? Yes. What'd you do? I just saw the first one. Is it a bad idea to try to get pregnant 2 weeks after a chemical pregnancy? No, that's fine. You can get pregnant anytime after a pregnancy. It doesn't matter. I am 10 weeks preggo, donor egg IVF. Congratulations. Modified natural aspirin. Awesome. I started baby aspirin since transfer and bled some last week. Does baby aspirin cause bleeding? It can. No thrombophilia issues. Should I take it? Stop? Yeah, talk to your doctor. I can't advise you on individual level issues, but speak to your doctor and make a decision. Typically for us, we do an ultrasound, see if we could see a bleed. If we see a bleed, we stop it. If we don't see a bleed, we don't. But talk to your doctor because I don't know your case in particular. Okay, Serena Stutler. That's a great name, Serena. Is CoQ10 good for conceiving? CoQ10 is awesome for conceiving. We have a whole video with 35,000 views or something like that on YouTube. So check it out on YouTube. There is no question that you should be on CoQ10. We use it for a lot of different patients. If my fallopian tubes are full of liquid, are my only options removing them, or can the liquid be removed? Your only option isn't removing them. You have the option of surgery and tuboplasty and correcting it, but you can't siphon out the fluid from the tube. It'll come right back. So you either have to remove the tube or you have to clip the tube, which I never recommend because it's a setup for an abscess, or you need tuboplasty where they reopen the tube. That's difficult and it's very expert level work, but like many of us still know how to do it, so we do. Does a polyp have to be removed, or can you still conceive with a polyp? It's a 50% reduction in success. It's a 100% increase in miscarriage risk. So we never recommend getting pregnant with a polyp, but you can. I mean, that's up to you. Can someone with premature ovarian insufficiency get pregnant with their own egg, even if they had POI for 20 plus years? Wow. Can you? Of course you can. Will you? Different question. That's difficult to know. Unlikely. Why does Dr. Amy, that's Amy Avazada, the egg whisperer, a friend of mine, recommend a trigger shot IM for curvy patients? Because IM will get into your bloodstream faster, and in your fatty tissue, it'll distribute more slowly and you need way more HCG. So that's not an unreasonable thing to consider. Should you continue CoQ10 and resveratrol during ET and after? We do. You have to talk to your doctor. What brand of resveratrol, NAC, and CoQ10 do you guys use at your clinic? You are the sweetest and kindest doc ever. Thank you for all you do. Thank you. That's very kind of you to say, Kurtana. I don't think the brand makes a difference. And in fact, to be honest, I don't know what all the brands that they use at the pharmacy are. It doesn't really matter. Any brand is good. I know they use a lot of products from NFH. CoQ10, you can use any brand. It doesn't really matter. So I don't really think it's necessary to be brand selective. The dose is important. The brand's not a huge issue. Will estradiol patches cause a flare? I don't know what you mean. A flare of what? Can adenomyosis cause miscarriage after the first trimester? Yes, adenomyosis can cause miscarriage after the first trimester. Is PGT test necessary? I'm 39 years old, no genetic history issues. In my opinion, yes. At 39, 80% of your embryos are going to be genetically not normal. You need to know which embryo you're transferring. So we would definitely encourage someone 39 to do PGT. Is it mandatory? No. Should it be considered? Absolutely. From a financial standpoint, it'll reduce your costs depending on how many embryos you have, of course. And from a research standpoint, the time to pregnancy is faster. They have proven that, so that makes sense. And then from a emotional standpoint, like, do you really want to get genetically abnormal embryos transferred into you? Because either they're not going to fail, or you're going to have a miscarriage, or God forbid, you're going to actually end up getting pregnant with a baby that you then have to terminate because you find out it's got an anomaly. So I believe in testing. Hi, Doc. This is Alexandra. I'm MTHFR 677T homozygous, currently 6 weeks pregnant, spotting due to a small SCH. Do you recommend to continue baby aspirin and Lovenox? You got to ask these questions of your doctor. We always look with ultrasound and determine how big it is and then make a decision. I often will stop if I see a bleed. And then bring people back online after a little bit. There is apparently a doctor, a reproductive immunologist in Michigan, who swears by using IVIG to shrink the subchorionic hemorrhage. And I know we had heard this before once as well. I can't get anybody IVIG. It's like $5,000 per treatment, and we certainly won't get permission for that kind of situation, but I'm interested in how that works. I guess they're thinking it's immunological mediated. So it's kind of interesting. Thank you for your answer. You're welcome. If I failed my 1 hour glucose test last pregnancy, but passed the 3 hour, do I automatically have to jump to a 3 hour test in a future pregnancy? No, you can still go to a 1 hour. That's easy. IUI was canceled last minute due to sperm. Previously, cycle was perfect. How can sperm concentration be reduced? I don't know how it was reduced. I mean, maybe you had intercourse recently or too close to that time. Generally speaking, we don't cancel an IUI. We'll still do it, even if the sperm quality isn't the greatest, because you're there, you've done everything. Like, it's a waste not to, and there's always a chance. How can you improve? Watch our video on YouTube on the male video. So there's 4 easy ways. Ejaculate every day or every other day nonstop, not just around ovulation, the whole month. Take your fertility vitamins, doesn't matter which brand, but male fertility vitamins. Make sure that you are not smoking, drinking, or drug use, and I mean 0. Don't smoke, don't drink, don't use marijuana, don't use any other drugs. And lastly, keep the testicles cold. All of those are really important. Can endo cause miscarriages? Yes, there is good evidence that endo can cause miscarriages. We have a great new video on YouTube. Please watch that. I think it's called Doctors Aren't Telling You the Truth About Endometriosis. Watch that video. Most doctors are not telling their patients the truth. What's your standard protocol for a fresh transfer? Wow, we don't do a lot of fresh transfers here. But if we do, we start the progesterone on the night of the retrieval. And then we wouldn't give anyone estrogen unless we had to, because your lining wasn't thickening or it was getting too thin. So that answers that part, I guess. And then all the vitamins and supplements. How come I freeze the embryo before implanting it? Studies show that frozen embryo transfers have either an equivalent or a higher success rate and a much safer pregnancy. In the grand scheme of things, the only thing that anyone has ever really shown, which is worrisome about frozen embryo transfers, is that the babies tend to be bigger. And if you have to choose between a small baby and a big baby is going to be a much healthier baby long term. So we always err on the side of that. The other thing is that your pregnancy risks, if you do a fresh transfer, are higher for things like preeclampsia, IUGR, growth restrictions. So we want to avoid those major problems. What is the optimal lining thickness for a fresh transfer? Optimal lining thickness, fresh or frozen, is 8. Between like 8 to 13 millimeters. Is lower back pain during second trimester normal? If it's not rhythmic, it can be normal. Impossible for me to say without knowing the full history, but yes, it could be normal. You just have to get checked out and see specifically if it's like palpable, like can they push on it and it hurts, because that's probably just muscular, or if it's deeper inside, in which case you got to figure out what's going wrong. Concern my irritable bowel syndrome diagnosis could be endo, but no painful intercourse. FET prep, want best chance, 39. There's tests you can do now. It's not ideal, but they'll kind of predict whether you have endo. There's Receptiva, which I'm not a big believer in. And then there is a new one called Endomere, which you could also try. Reasonable. You know, I don't love it. Like, I still don't know. I mean, people that I suspected had endo are getting these really low scores. So I still think they have endo, but the score is telling me I shouldn't think that. So I don't know. I mean, I haven't operated on them to find out, but it'll be interesting if we had that study. Now, that people that made Endomere have that study, but I don't have that study, and I want to know if it applies to my patients. So I probably will keep track of that as we go through it. Best FET prep, if you think you have endo, is vastly different than if you don't, at least in my opinion. Do you prefer non-medicated FETs over medicated? So hormone replacement therapy like estrogen and progesterone FETs have the lowest chance of success and the highest risk of failure and the highest complication rate in pregnancy. Had a successful pregnancy with a medicated transfer, but 2 failed ones with non-medicated protocol. Interesting. In your case, I would probably stick with what worked for you. I don't think it's the protocol that's the issue, though. But I mean, I'm a big proponent of if it ain't broke, don't fix it. How does the HIFU, High intensity focused ultrasound work for adenomyosis. Is this a series of treatment? Yeah, so I've not even seen it done. I know about it, but I've not seen it done. Basically, they beam this focused ultrasound into your uterus in the hopes that it's going to cook with heat, literally, the area of adeno and kill off those cells. I mean, if you've got a focused adenomyoma, it might work. If you've got diffuse adenomyosis, you're zapping your whole uterus. That's not a good idea. And I don't know if it's a series or not. I've literally never seen it done. Should I continue exercising if diagnosed with small subchorionic hematoma 6 weeks pregnant? No. Take it easy for a while, Alexandra. Your exercise can wait. Samantha, I answered your question. Is there anything other than surgery for PCOS? Who on earth told you needed surgery for PCOS? Serena, that's crazy. Nobody does surgery for PCOS anymore. That's completely unnecessary. Yeah, you don't need surgery. Ovarian drilling, which was the treatment for PCOS, or wedge resection, which nobody does anymore, is like a dinosaur medicine. We have so many good therapies now, supplements, diet plans, exercise regimens, all the supplements that we use, so NAC and inositol, CQ10, resveratrol, ALA, and then you've got letrozole, you've got metformin, you've got weight loss drugs. Nobody should be getting surgery for PCOS. That's cray-cray. I answered part of that, but maybe they're asking two different things. What's my standard protocol for fresh transfer? Start progesterone the night of the retrieval, transfer 5 days later when you've got your embryo. Only add estrogen if you have to. And yeah, that's it. I think I answered that already. Reoccurring giant hematoma with 3 pregnancy, no cause findings, 6 miscarriages. Any suggestions? I would need a careful look at your uterus. I would recommend you do fertility testing so that we can assess to see if there's infections there or immunological problems there. I would also want to look at multiple other factors like your vitamins, your thyroid, your hormones, your habits, your partner's habits. What's the DNA fragmentation like? Like there's a lot to go into genetics. Thoughts on doing another implantation after congestive heart failure with previous pregnancy? I wouldn't touch that until an internal medicine specialist and a maternal fetal medicine specialist had cleared you. That's critical. Is it recommended, this is from Live, Laugh, Lift, to keep the heart rate low with exercise during the 2-week wait? Yeah, we tell people to keep their heart rate under 120 in general. If you're speeding up your heart rate that much, it's pumping hard to deliver blood to your muscles because you're overdoing it. And if you're overdoing it and you're making your heart work that hard, you're pulling blood away and oxygen away from your uterus and the fetus. That's not a good idea. I'm very conditioned and trained daily. You can still train daily, just keep your heart rate a little bit lower. Don't go crazy and don't lift heavy. Are the SIS procedures done by you or a nurse? Both. I do some, they do some. I've trained them all. They're very good. And it's obviously being done by our ultrasound techs. If people want me, I can do it. But if they're happy with everybody else, that's fine. Serena, who asked about surgery for PCOS, says, "Oh Lord, thank God I said no." Yeah, thank God you did. I agree. Who does that? Like who? I'm curious. How many people out there were offered surgery for PCOS? I would love to hear this. Somebody please tell me. Jana, for God's sakes, you need to go to bed. I love you, but you need to go to bed. Can a growing polyp 8 millimeters in the uterus affect chances of pregnancy? Yes. 50% reduction in success, 100% increase in miscarriage. Is it safe to take supplements like L-theanine while TTC and after conception? I'm not familiar with L-theanine, so that one I don't know. Hi, Jana. Hello, dear Dr. Veer and Dr. Victory and Dr. Tarek. He's not here, actually. Is there an advantage using injectable estrogen for lining in a HRT FET cycle compared to oral vaginal? No. Not that anyone has ever proven. Struggling with lining, greetings from Kitzbühel. Oh, you're always at Kitzbühel. I'm totally jealous. You have to take me to Kitzbühel one of these days for all the questions I've answered for you. And go to bed. Hi, Dr. V. I got 59 eggs collected. Woo! During my egg retrieval. Curious what you think stats-wise our embryo yield could look like. We're doing ICSI and are 27 years old. Oh my God. I mean, it depends on the quality of your lab and the quality of your sperm, but you should, at 27, you should have an enormous number of follicles and embryos develop, like huge, huge, huge. Yeah. Thoughts on doing another implantation after congestion? Yeah, I just answered that one. Can HRT help you get pregnant if you have POI for 20 plus years? Absolutely no. HRT won't do anything for you if you've had POI for 20 plus years. Thoughts on PRP for a 42-year-old after 2 failed IVFs, only 3 to 4 mature eggs retrieved and no euploid? Yeah. So here's the thing about PRP. First of all, we still don't know if it works. Nobody knows if it works. The studies that have examined it are actually showing it may not work. And more importantly, despite what one very famous doctor out there is claiming about PRP, which is total gibberish because not a shred of proof to sustain what he's claiming, the reality is that it does not improve egg quality, and it's certainly not going to change egg genetics. So the only thing you're doing is getting more eggs with PRP. You are not getting better eggs, you're getting more eggs. And so, yes, you might possibly get more. I think in some cases you can. I do believe that. But the reality is that you're not getting better quality eggs. So at 42, and I take these calls like every day. I get 2 calls probably a day. Women who are older, they want PRP. And I'm, I guess, the only one in Canada doing it. So they're all coming to us. And I say, like, this is not going to work for you because if you're 47 and you want PRP, you're still 47. You need an enormous number of eggs. Yes, you might make 1 more with PRP or 2 more, but you're not going to make 10 more. And I need like 50 more, right? You need a ton of eggs at that age to get just 1 normal pregnancy. So, I mean, at 42, it's borderline. I think there's a chance that it would work, but I'm not pushing it. Can focal adenomyosis be removed surgically? Yes, it can be removed surgically. Can you consume unpasteurized honey from your local area? You're never supposed to do that. I guess there's a Botox risk, if I remember correctly. I've heard it's good for allergies, but the unpasteurized part has made me worried. Yeah, about botulism. Yeah, no, don't do that. Have you heard geritol to be good for pregnancy? I don't even know what geritol is. Can prednisone cause any negative side effects in a fetus? Yes, cleft lip, cleft palate. Do I ever recommend ASA pre-egg retrieval? All the time. It works really well. Jana, for sure, I'm always welcome to Kitzbühel. I'm coming. Do you recommend anything for PCOS? I am trying everything: hormone, balance T, myo, and D-chiro, and ostol. Yeah, just take letrozole. You're taking everything natural. Take letrozole, it'll make you normal. And make sure you're losing weight if weight's an issue for you. What are your thoughts on supplements, desiccated bovine thyroid, adrenal? Yeah, those are all dangerous. They are unregulated and they can have prion disease, which is mad cow disease. Stay the hell away from that stuff. Thank you for my time and answering your questions. So caring. Oh, my pleasure. Thank you for saying thank you. You know, I had a couple on recently with me in a consult, and this is the first time ever. And the gentleman that I was speaking to teared up, and he said, "Thank you for spending so much time with us, because no one has taken the time to spend time with us and explain things to us and go over things." And I felt so bad. Like, it was so endearing. Like, I really felt heartwarming feelings because it was so raw and so emotional, and I really kind of felt connected with them as a couple, and certainly him guy to guy. But I also felt so bad that we as a profession are doing such a crappy job in educating our patients that a male, and not to make any stereotypes, but I mean, guys don't cry nearly as much as women do, that a male was tearing up just because we were giving him good information. Like, How bad does that suck? We've got to be absolutely horrible at what we do to be down to that level where men have that visceral emotional response to just getting in education and informed. So to that couple, my heart goes out to you. I love you both. I really do. You're a very nice couple. And I'll bend over backwards for anyone pretty much, but like, God, what a negative comment on fertility. I mean, it's devastating. And I was talking to other couples about, offers to buy VRC, which I get all the time. Don't panic. I'm not selling. And I think it's actually kind of like, it's becoming almost kind of immoral to sell because everybody else is the same. They just want more money. And when you sell to venture capital and private equity, they need to be profitable in order to sell the company for more so that whoever owns the VE and PE can make more money. They're not looking for best outcomes. They're looking for maximum profitability. I'm not looking for maximum profitability. I make enough. I'm very happy. I'll probably go into debt sending my crazy daughter to Scottish medical school, but that's okay. That's what we do. All I want to do is do a good job. And if we make money doing it, I'm okay with that. But I don't ever want to compromise care or make sure that my goal is to hit a special financial target because it isn't. But thank you for those questions. Is the miscarriage risk higher in women with unexplained infertility? Yes. Yeah, there are several studies showing that for sure. June Abigail Mariano, great name. Dear Dr. V, please make a video on rapamycin. We have a video on rapamycin. Thanks for sharing your knowledge to us. Always, God bless you. Thank you. I am very blessed by God. We have a video on that. It's about 5 months ago. God, I don't remember. It's on endometriosis and that rapamycin improves the outcome. So watch that video. We have a video on rapamycin. Jana, is transdermal the least harmful way of taking estrogen for an FET? Yes, transdermal is the least harmful because it has the least elevation in C-reactive protein. And that's fine. Hello, can you tell me about IUI? Sure. We take your partner's sperm. Well, okay, let me back up. There are 3 ways to do IUI. You can use a woman's natural egg. You can use a woman's eggs where we've stimulated with a pill, or you can use a woman's eggs where we've stimulated with injectable medications to make you make more eggs. The key is to make sure we don't make too many eggs. Maximum you want with IUI is like 2 or 3. So then as far as the actual process is concerned, we monitor the growth of your eggs, natural or stimulated. When they hit a special target in our clinic, we trigger for the release of the eggs. And then 36 hours later, you should come in and you should do a sperm collection. You should probably be there about 35 hours. They should do a sperm collection from wherever the sperm is coming from, wash it, prep it, and then inject it into the uterus. And then there are studies that support the fact that we've been doing this for a long time, you should be on progesterone afterwards. It does improve your chances of success. So that's the basic IUI process. Now, I'm in the process of making a video because one of my clients told me that at a nearby fertility center, they were told that they can do an IUI 3 days after ovulation. You cannot do an IUI 3 days after ovulation. There's a New England Journal study from 1995, which very clearly showed that basically 24 hours after ovulation, it's 0% chance you're getting pregnant. So if someone told you to do an IUI 3 days after ovulation, they made a mistake. Yeah, please don't do that. That's crazy. Serena, you would have to get your doctor to prescribe letrozole. Yes. Does keto diet help with endometriosis and or fertility? Keto diets probably could help with infertility if it reduces your inflammation, which they don't always because it depends on what you're eating as part of your keto diet. And for endo, I'm not aware of anything that suggests that a keto diet would help with endo. I've never even seen that before. As an OBGYN, how do you manage a vasa previa patient? Oh God. Yeah, you got to admit vasa previous to the hospital because it's life-threatening for mom and baby. And you're supposed to section them around 34 weeks. So we don't wait very long. If you could stretch it out to 36, that's fine, but you can't wait very long for that. Can too much DEA reduce the number of eggs retrieved? Not that I've ever read or seen anywhere, so I am unaware of that. Do you ever recommend oh yeah, I did that one. Is adenomyosis diagnosed with sono? Yes. If you have adeno, is it more than likely you have endo too? Yes, it can be. Adeno and endo are kind of cousins, so there is a higher association between having both. When do people stop baby aspirin? When starting baby aspirin before transferring, continuing when pregnant? 12 weeks? No, I keep my patients on it right until they deliver, actually. Are you the only clinic doing PRP between Toronto and Windsor? Okay, I don't know, but supposedly from what people tell me, I'm the only person doing PRP in Canada. So I think I'm the only one. I don't know. It's not like I ask around. I have a friend whose HCG levels are 65,000 at 5 weeks. Multiples? Possible. Yeah. Or a mole. So make sure it's not a molar pregnancy. Hello, did my first IVF cycle and it failed. Oh, I'm so sorry, Melissa Hepke. Only 2 mature eggs and only 1 fertilized. I'm 34, AMH 0.99, history of hyperplasia without atypia. Is there any hope for me to ever become pregnant? Of course there is. There's lots of hope. At 34, even with a low AMH, you still got hope. I would want to know the rest of your history, but there's always hope. So talk to us, ask for a consult. We'll be happy to chat with you, design a custom protocol for you. I do not do cookie cutter protocols. If you're new to the show, we don't do cookie cutter protocols. Everybody should be individualized. Some people need DHEA. Some people need testosterone, human growth hormone. Some people do benefit from PRP. 34, low ovarian reserve, that is someone that would be reasonable for PRP. So everybody's different, but it is critical that you get good advice for sure. Do I use letrozole for IUI? Yes, I use letrozole for IUI. Mariam Soliman, can aspirin cause bleeding during an FET? Yes, for sure, it can. Asherman history here, doc. Did 3 months suppression. Shall estradiol patches can cause flare? I still don't know what you mean by flare. Flare of what? A flare of Asherman's? Asherman's doesn't come as a flare. I'm confused. What are the side effects of letrozole aside from chances of multiples? Generally speaking, nothing. Some women get headaches, moody, stuff like that, but we have very, very few. Luteal phase versus follicular phase IVF. When is one more effective than the other? If you believe the studies, the luteal phase is better. If you believe me, different patients respond differently. Although I'd say overall, we do tend to get slightly better results from our luteal phase, but I have had patients go both ways. I've had patients do terrible with a follicular and then brilliant with a luteal, and vice versa. We've had patients do great with the follicular and terrible with the luteal. So I think everybody's different. Fertility friendly lube or moisturizer. There's lots of them. The most common one would just be pre-seed, but you can use any water-based one if you're not actually trying to get pregnant because you're obviously on Lupron letrozole. The other ones are ones like Gynatrof, Gynalac. There's another one I forget now. All the stuff we use in menopausal women. I don't remember the name of the other one, but Gynatrof, Gynalac is great. We use a lot of that, so that works well. Okay, back to YouTube. 30, trying for 3 years, unexplained infertility. Should we wait to try IVF, start ASAP? Okay, we have a great video on YouTube on unexplained infertility. There's only 4 things that work, okay? So this is my whole like half-hour video in 30 seconds. Number 1, you can try insemination with pills. You do not have to jump to IVF. Number 2, you can try insemination with shots. Number 3, you can do IVF. And number 4, you can get more answers. So how do you get more answers? You either do surgery to see if you have endo, adeno, funny shaped uterus, tubal damage, whatever the case is, or you do a test with some kind of company. We use Fertility, but whatever you want, where you test for microbiome and you test for your immune status to see if they're missing something. So you don't have to jump to IVF. You definitely need help, but it doesn't have to be IVF. There's lots of options. Wow, I think I'm answering all the questions. Taylor Keene, YouTube. Hi, Taylor. Do you recommend different supplements pre-egg retrieval versus pre-transfer for patients with endo? Nope, same supplements. I heard curcumin could cause thin uterine lining and not sure what to take. Yeah, people talk about curcumin causing thin lining. I've never seen it. And the effect on endo is so good with curcumin, it's kind of hard to resist. So we use it liberally. We don't have a thin lining problem. We would offer our patients NAC, curcumin, resveratrol, CQ10, and ALA as add-ons because they're endo patients. And then on top of that, we would do the basics, which are your prenatal, your vitamin D, your fish oils, and melatonin. All of those are good for retrieval and they're good for transfer. Why does heparin help with thin lining? Improves blood flow, Jana. So it prevents microvascular clotting, and it's also a really good anti-inflammatory. So it'll let the blood get to the uterus better. If letrozole suppresses estrogen, won't this impact the lining? How does it grow otherwise? Letrozole doesn't suppress estrogen that much, and it does allow the lining to grow. It's less uterine specific. So remember, it has different actions in different places. And it still allows your estrogen to grow, just not that much. How does one ensure they have adequate lining? Oh God, if you figure that one out, let me know. I don't know. I mean, there's no way to ensure it. Sometimes we try and it's trial and error, but there are things you can do to kind of try your best to make it as good as possible. First egg retrieval a year and a half ago had 8 blasts. Wow, 3 chemicals and 1 failed to implant. No endo symptoms before. After endo symptoms are really bad. Another retrieval before, after a lap. Oh God, no. Always do all of your retrievals before you're going to do surgery. Because remember, every time you do surgery, like you got worse. And it's going to happen again if you do lap first and then do a retrieval. You're just making your endo worse again. So always do all of your retrievals first, then go for your laparoscopy. Anything else does not make sense at all. And we tell our patients that. So when we do our endo protocol, which is essentially our 3 months of suppression is the start. If we're going to operate, we operate while they're suppressed. So they've already done everything. They've done all their retrievals and they're going into a frozen embryo transfer. Thoughts on hot tubs and warm baths, men and women, TTC? Terrible, absolutely terrible. For guys in particular, heat is horrible for your testicles. We make our guys sit on frozen peas. I tell all of them to avoid hot tubs, jacuzzis, saunas, cell phones in their pocket, laptops on their lap. Yeah. Justina Kemmerer, what if I have POI? What can I do? I need to talk to you, but there are treatments. DHEA can help. Human growth hormone can help. Testosterone can help. Acupuncture can help. Naturopathy can help. PRP might help. Depends on how old you are. So there are a bunch of different available options for you to help improve your chances of success. Does Valium before transfer reduce cramping? No. A good embryo transfer reduces cramping. Typically, our patients are not that crampy when we do our embryo transfer because we're super gentle. If you're cramping, then it's probably not being done right. And even if it is being done right and you're cramping, tell your doctor, because if we just wait, it'll go down. Yes, you can use a heat. Well, Cecilia, when you say heat pad, no. Don't use heat pads because they emit electromagnetic radiation. So Cecilia is asking if she can use a heat pad before a PIO injection after embryo transfer. Electromagnetic radiation does come from blankets. So you don't want to use a blanket. Use a warm water bottle or one of those sand things you throw in the microwave, but don't use an electric heating pad. Good question. Would I consider 11 follicles for an endo patient to be a good amount? AMH was 0.3 nanograms, 1.8. And FSH 15, 11 mature follicles? Jill, that would be awesome. You did really well. Yeah, that's a great number. I actually nailed it. I got every question, guys. Anyone have any other questions? We got 4 minutes left. Or talk about you. I want to hear how somebody's day was. Or tell us what we can do to make the show better. Topical lidocaine. Oh, that's interesting. Cecilia, it's an IM injection. So most of the pain is coming from the fact that you're shooting it into your butt. Topical lidocaine is only going to work on the surface. So it's not going to help you when it goes into your butt. I started baby aspirin before transfer and got pregnant and now 10 weeks. I had some bleeding last week for a day. Baby is fine. Should I continue or stop? Everybody's asking me all these aspirin questions. This is great. I can't answer those. You need to talk to your doctor. We would do an ultrasound to see if you have a bleed and make a decision based on that. But I can't answer patient-specific questions. Can I use Prolutex instead of PIO? Yes, you can. Should I do this if doc never worked with Prolutex before? Yes, that doesn't matter. Oh, wow, the questions are coming in. After a consult with you, how long is the wait to start IVF? If you're doing private, and we have testing already, a month. If you don't have testing already, I got to do your testing, have a chat with you, make sure you review everything. A couple of months. Can Viagra harm lining growth? No, it's the opposite, Janet. Viagra has been proven to improve lining growth. You're still up. Should you detox to help conceive? I don't know what you mean by detox, Serena. I mean, like stop smoking, drinking, using drugs? Yes. Go for one of those, like, I'm going to have 50 million grams of caffeine to evacuate my bowel detox? Hell no. Absolutely no. Hi, Dr. Victory. Third IUI ended in a miscarriage. Oh, God, I'm so sorry. Should I continue IUI or book an appointment to speak with you? 26 years old. You should book an appointment to speak with me. Any contraindications or precautions for having intralipid infusion now that I have gestational diabetes? No, no contraindications. I had 8 at start of stims last year and responded poorly and only got 2 mature. The 11 follicles were at baseline. I'm priming with androgel for this next cycle and changing a lot of the meds. Jill, I would need to look at your protocol. We would tell you to do several things. DHEA, we would do human growth hormone, make sure you're not doing estrogen priming, make sure you're not taking birth control pill, get lots of sleep, don't look like me exhausted because I'm always exhausted. Too many patients, too much work. US, this is from Delhi, US doctor partners for getting more answers. Done IUI, HSG, all the natural recommendations. 3 doctors refused to investigate endo. Told IVF is my only option left. Yeah, skip the US doctor and come to us. I don't know any US doctors that do what we do and just offer comprehensive care. Everyone basically says, no, you need IVF, and they railroad you into IVF. Or they're not capable of offering you the surgery because they don't do it themselves. So I would just say, do a consult with us. It's cheaper to come to us than it is to do it in the US, and it is very, very, very easy. We have literally hundreds of patients coming across the border now. Winding down, it's 9 o'clock. I'll answer a couple more questions. Does too high a dose of DHEA? I answered that one, Evgenia. It does not, to the best of my knowledge. Does a LEAP procedure affect the outcome of IVF or IUI? Normally, I would say no, although yesterday I saw a study that said it might. But I'm not convinced on that one. Today was my first FET following your immune endo protocol after five failed embryo transfers with 3 other clinics. Really hoping this is the one. I extremely appreciate all your knowledge and hard work. Thank you. My pleasure, and happy to try everything I can for you. Where am I located? Windsor, Ontario, Sarnia, Ontario, Woodstock, Ontario, St. Catharines, Ontario. Is an SIS okay to do while what, JLP? I don't know what you're asking. Okay, last question. On suppression. Oh, yes, it's fine while you're on suppression. Last question. How long after endo surgery is fertility at its peak? 6 months to a year. Yeah, and it's likely to come back within 6 months to a year. It is 9:01. I am on call tomorrow and I'm exhausted. If it's not too busy tomorrow night, I'll probably bring my camera and my tripod and do one of those Instagram Ask Me Anything things that I've done before. So if you have more questions, hang on to them till then. And I'll post a kajillion of those things. Let me know if you have any other questions. Always give us feedback about the show. And please, please, please go on YouTube and bring your friends to Instagram and YouTube, because I am perpetually frustrated that Instagram basically doesn't let us grow ever. So my challenge for all of you guys, for all the work that we do, please bring at least 5 new followers for us on Instagram and YouTube. Hope you guys have a wonderful evening. And for those of you that are struggling, my heart goes out to you. We are here for you. Contact us. We will do our best. We always do. Have a good night, guys. Thank you. Nat, thank you. And Tarek, you better sure as hell be recovered from your trip to Egypt by next week. Love you, buddy. Hope you're well. And you guys